Hello, I'm Dr. Stephen Blomerth and you're watching Natural Health Today. This show is dedicated to your problems, your concerns, your questions, and we open it up each episode to people who have written in to my office or to my email or called my phone number. Talk about things that you're interested. Talk about questions you may have about yourself or a family member, and there's 3 different avenues that you can use to participate. One is you can send an email to pbdchiropractic@gmail.com, or you can telephone my office at 978-535-6155. You can send an old-fashioned handwritten snail mail letter to my office address, which is 215 Newbury Street, Suite 102, PBD, Massachusetts, 01960. Whichever way you choose to participate in the show will slightly disguise your name so your friends and neighbors won't know it's exactly you who's writing in about a problem. Sometimes some problems are a little bit embarrassing to talk about, but we can sidestep that by disguising your name. And what we'll do is we'll talk about different ways that you may be able to help yourself through natural means. And when I talk about natural means, this is what I mean. Natural health care means to me either one of these 4 routes. One is manipulation of joints that are stuck. Manipulation of joints that are stuck can have all kinds of very positive freeing from pain, restoration of function, and return to normal life. So very important to do that when we find a joint that is stuck or stiff and doesn't move the way it should. Another avenue of care is muscle therapy. Now, I'm not talking about massage. I'm talking about finding knots in muscles and finding restrictions, because there are bands of what we call fascia that cover the muscles that go all the way from your feet all the way up to the top of the back of your neck. And these bands interact with one another to the extent that something in your foot can affect all the way up here. You may not even feel pain in a given area where you have the problem, but it can cause a reflex effect far away from where you have a problem. A third avenue of care is exercise. And I'm not talking about typical gym exercises, because I think typical gym exercises really cause more problems than they help. I'm talking about stabilization exercises, and the type of stabilization exercises I do myself and I give to my patients have been invented by a group called the Foundation Training people. Foundation training will probably take you further to recover from an injury or stabilize yourself so it's less likely to have an injury than any other set of exercises. And what I like about them, they don't take a long time because they're very tiring in a short amount of time, and you don't need any equipment. It just means you have to pay attention, follow the forms, and do these exercises that strengthen muscles that need to be strengthened and stretch muscles that need to be stretched. And the last means of health care that I put under the framework of natural health care is nutrition. Nutrition is a lot more than just eating a balanced diet, because many people eat a balanced diet, or what they think is a balanced diet, and yet they have a big beach ball in their belly. If you're overweight, you're not eating a balanced diet. Eating the right foods is sometimes the thing that separates how long we live, how comfortably we feel, and can be the difference between coming down with diabetes or many other diseases. Even Alzheimer's has a nutritional component, or staying healthy. So that's a big aspect of what we do at our office, and we try to pass on things that I've learned in 37 years of practice to my patients. So with that being said, that's what I mean by natural health care. I'm going to put on my reading glasses and we'll look at some of the questions that have come in since our last episode. Okay. Laura writes in from Danvers. She says, my husband keeps saying, "Why do you forget so much? I don't even realize I'm forgetting things half the time until he tells me. But I do know I will forget about things around the house, like what I'm looking for." I'm so afraid to think I'm getting Alzheimer's because my dad had that. I'm kind of afraid even to admit it to anybody. How do I find out? Well, Laura, there are certainly many tests these days, cognitive tests that you can get, written tests, to see if you have Alzheimer's. It's not something that's usually found in a person while they're alive, because in order to find Alzheimer's tau bodies in your brain, usually they're found on autopsy. So Alzheimer's is usually a diagnosis based on ruling out X, Y, and Z. But you know, there's several other diseases and even nutritional deficiencies that can give you some of those memory problems. When you talk about memory, a lot of people don't realize thyroid has a big effect on your memory. So if you think you're starting to notice memory problems, having your thyroid panel and a complete thyroid panel. Now, what is a complete thyroid? It's probably words and letters you have a hard time remembering, but I'm going to tell you them anyways. You want to look at your T4, your T3, your reverse T3, your TSH, and your thyroid antibodies. So that'll give you an idea of how your thyroid is working. But you also want to look at a few other things. You want to look at your B vitamin levels, you want to look at your magnesium levels, and your vitamin D levels. All these things, all these nutritional components have a big effect on our memory. And how many people pay attention to what they're eating? Unfortunately, not too many, because what we eat has a huge impact on our memory and whether we come down with our Alzheimer's. But again, you may be having memory problems and have it just be a nutritional deficiency or a thyroid problem. So don't get lost immediately in thinking you're having an Alzheimer's problem, because here's the truth. Simple stress can make us become forgetful. Where does stress come from? It's different for everybody. But here's an example. I have a cousin who has had a daughter who's had some degree of mental illness for many, many years. So the worry about this daughter, is the daughter going to have an overdose? Is the daughter going to do something crazy? Is the daughter going to burn down the house? That kind of constant stress, year after year after year, it does things to our brain. Our brain actually, they've studied people who've had stress for years, our brain actually shrinks and shrivels when we're under stress, so that, you know, when each of us may be under a stressful situation from time to time, and you feel this feeling in your head like your nerve ends are fried or frayed. Imagine if you had that every day of the week, year after year after year. It does cause an effect on your brain, and one of the first things to go is memory. So loss of memory isn't always Alzheimer's. It can be thyroid, it can be chronic stress, it can be nutritional deficiencies. Don't fear the worst, but get some testing done. Remember that eating a good diet has the best long-term effect on keeping all these different problems with the brain from coming to the fore. So help yourself, eat well. You can consult with my office about what is good nutrition. We'll try to give you some pointers. Sometimes it's taking supplements, sometimes it's just eating a better diet than you're doing now. Or it can also be learning to release that stress. Laura, thanks for that question. Our next question, Ray writes in from Middleton. He says, I keep having bad back pain, just like everyone in my family. I don't think any kind of treatment will help me, but my sister felt better for a while when she got a custom-fitted back brace. Do you know how long these custom-fitted braces will last? Well, Ray, I think you used the right term. Your sister had some help from a back brace for a while. Now, I almost never recommend back braces. A back brace is kind of a crutch. If you absolutely need a crutch, there's a time and a place to use it, but you don't use a crutch all the time. The best treatment for most back situations is manipulation of joints that are stuck, muscle work to get rid of trigger points, proper exercises. Are there some people who need back braces? Well, sure. If you've had a compression fracture or some sort, I have a friend right now who's battling multiple myeloma, and the multiple myeloma went into his fourth lumbar vertebrae and caused it to collapse. And this collapse of that vertebrae, that's something in which having a back brace, when you've had that kind of mechanical insult of a tumor causing a collapse of a vertebrae, sure, that's a situation where people will benefit from a back brace because not much else can help. But how frequent is fractures in your back from multiple myeloma or any other disease that eats up the vertebral body? They are rare. They are 1 in a million. So don't base your life on something that's rare. Take a little bit more control of your life. Get the help that you need. And remember, just because your family has a tendency towards having back pain doesn't mean that everybody always has to have it. It just means you have a tendency. It can be fought by getting the right care, doing the right exercises. So Ray, thanks for that question. Do I think a back brace, a custom-fitted back brace will help you? Only if you fall within a very narrow spectrum of having a collapsed vertebrae or some very serious pathology going on in your back. But again, those situations are rare. Okay, our next question comes from Michelle. She writes in from Danvers. She says, all last winter I was getting stiff and swollen in my left hand whenever I had to be outside too long in the snow. But ever since the late spring, it seems to have cleared up, and I can't remember the last time I felt it, except when I go on a long bike ride. Any ideas what I have or how to help it? Well, Michelle, I do have a little bit of an idea what you have. There's something with a funny name called reflex sympathetic dystrophy. I know it's a long word, and it's probably hard to understand what it means. But let's break it down. Reflex, well, it means that your problem with that cold sensation is coming up because there are certain reflexes that control the size of our blood vessels that go into our hands. And actually these nerves, they're everywhere. They control the size of blood vessels everywhere. But our hands and our feet, our body considers them not as important as our heart, as our lungs, as our internal organs. So in certain situations, when the temperature is dropping, the body says, well, we can live without the fingers, we can live without the toes, but we can't live without the heart and the lungs. So we'll make a choice. We'll shunt the blood to the internal organs, and we'll shunt it away from the fingers and the toes. So when that happens, your body has made a decision, and sometimes that's a bad choice, and sometimes it comes about because you've had a previous injury to that area, like a fracture. If you've had a fracture of a finger or toe, the nerves in that area have become screwed up and they don't respond properly. There are times when we, for survival's sake, may lose a finger or a toe because it's so cold out that to save us, our body makes that kind of a choice. It shunts blood away from the periphery to the central area. But when it's doing that improperly, it means there's been damage. And when you're having that in the summer when you go on a long bike ride, I think it's because you're putting your hands in a certain position. And the nerves that go into your hands aren't functioning properly, except it doesn't show up all the time. It only shows up when you hold your hands in a certain clenched position, as you might holding onto the handlebars of a bike for long periods of time. Those nerves feel the pressure. Because they're not working right, they start giving a tingly feeling. In the winter, it wouldn't be so much a tingly feeling, it would be a cold feeling. What can you do about it? Well, sometimes manipulation of your neck, sometimes manipulation of the joints into the wrist or the hand can help. Sometimes soft tissue work to free up the areas where you might have some compression of a nerve, that can be effective too. These are some things you can do for yourself. Just rubbing back and forth over the nerve that leads down into there, it can sometimes help, but seeking professional help is probably a wise idea too. Thanks for that question. That's a good one. Sometimes people get cold hands from a past injury years after the injury has gone away. Okay, next question comes from Sean. Sean writes in from West Peabody. He says, I got into a car accident last Tuesday. I got hit from behind by this kid who didn't see the traffic slowing down and smashed into me. My car was all screwed up, but I was just upset. I wasn't in pain. Then Wednesday morning, I felt like a truck ran over me. My neck feels so stiff it's hard to turn. How come? Is this what they call whiplash? Sean, without examining you, it's hard to say, but it's a pretty fair guess that, yes, you likely have whiplash. Whiplash, people don't always feel pain right at the time. There are times when people are in such a bad car accidents they feel pain immediately. But sometimes when they don't break a bone or have a cut, they'll have what we call a whiplash injury because of the acceleration involved. When you get hit from behind, it accelerates you and it causes your neck to go back and then slam forward. There are many tiny muscles and ligaments that hold the joints, the bones of your neck together. And if they get overstretched like that, they can respond by hurting immediately. Not necessarily. It might be 24, might be 48 hours. They can hurt later. So your symptoms coming the day after or even 2 days after is very, very consistent with a whiplash injury. What can you do about it? Well, for one thing, taking a good natural anti-inflammatory can be helpful. Now, I'm not talking about the ones you get in the drugstore, those the Aleve and the Advils and the Naprosins and the Advils. They stop the inflammatory process in a fashion that doesn't lead to repair. What are some good anti-inflammatories that aren't, that don't stop repair? Well, vitamin C is an anti-inflammatory. Cherries are an anti-inflammatory. The omega-3 fish oils are anti-inflammatory. Turmeric, particularly some formulations of turmeric that have been modified to make you absorb them. Because if you just put a little turmeric on your food or eat a little spice or curry, you don't really absorb that much of it to have an anti-inflammatory effect. But there are some companies, particularly including one from Australia called MediHerb, MEDIHERB. MediHerb makes a nice turmeric forte, which has a great anti-inflammatory effect, won't upset your stomach, and will help you cut down inflammation. What else will help you? Well, manipulative care to the joints that are stuck, and muscle therapy to the muscles that have been slightly torn, ripped, or otherwise traumatized in a motor vehicle accident. They'll all help you get better quicker. Just taking your MD's muscle relaxants, which, by the way, actually work on your brain and your nervous system, that put you to sleep. They don't really affect your muscles, except for the fact when you knock out the brain long enough with a hard enough hit of central nervous system depressants, which is what muscle relaxants that you get a prescription for. They are central nervous system depressants. So is alcohol. It doesn't lead to you being any better. It just makes you fall asleep. It doesn't correct the problem. Again, you just fall asleep. Falling asleep is not a bad thing. There's a time and a place for perhaps helping you fall asleep. But in a motor vehicle accident, you're not going to feel any better the next day. It's not part of the recovery or healing process, where the other products that I told you about, the natural things, the food type things, that will help you actually repair. So I hope that gave you a few ideas. I'm sorry you got into a car crash. It's kind of funny how you can be in a car crash, not hurt so much the first day, but have it come out the next day or two or even a week. It's not a fun thing. It's very upsetting. It's a little hard to understand if you've never had it happen before. But it can be survived, and you can get better if you do the right thing. Okay, Denise writes in from Danvers. She says, I think I have arthritis in my right knee because it feels so stiff after I run or go on a long hike. Is there any way to tell without a blood test or x-rays? You know, arthritis can show up to some degree on x-rays. Sometimes it can show up on blood tests. But a good at-home way, if you want to test your knee, is to just see how flexible it is. When you have arthritis, you can't basically bring your heel to your buttock. And so sometimes I test patients in office. I just try to bring their heel to their buttock. Now, you can do this at home too. It requires being having a little bit of balance. And when you do bring your heel to your buttock, remember, don't use the hand of the same side. So I'm going to test my left knee in a second, but I'm going to take my right hand and pull my left knee when I'm standing up towards my buttock. And if I can get it close within an inch or two of my buttock, it'll be a sign that I don't have arthritis in my left knee. You can try that at home. So let me illustrate what I'm talking about. Okay? So again, this is the knee. I'm going to test. I'm going to try to test the flexibility of this knee. I'm going to take my opposite hand and try to bring my knee as close to my buttock as I can go. Of course, I can't see my buttock right now, so I'll have to depend upon the viewers. But that's how you do the test. Obviously, don't do it if it brings out pain. And is it a good exercise for the knee or a stretch? I never do that myself as a means of feeling relief. If I have a knee tenderness or knee stiffness, I actually use a foam roller. Do I roll it up and down my thighs? I don't. I get face down on the floor. I get on my elbows like this, and I go back and forth. I kind of slide side to side so that the foam roller goes back and forth over the fibers of my quadriceps, and that can do a lot of good, particularly if you have a chronic sense of stiffness or tightness or even pain in your knee. That can help a lot. Other things that can help the knee: getting your feet adjusted. Luckily, I'm married to a chiropractor, so I have no problem getting an appointment to get my feet adjusted, but getting your feet adjusted feels great. And when I have knee pain from running, tennis, or softball, that's the first thing I do. Getting your feet adjusted helps the feet work properly. When the feet work properly, the knee works properly, and the pain goes away immediately. So that's about all the time we have for this week, so I want to thank you for watching Natural Health Today. I'm your host, Dr. Stephen Blomerth, and I invite you to participate in our show. Send in your questions. You can send them in either 3 ways. You can send them to pvchiropractic@gmail.com, or you can call my office at 978-535-6155, or you can send an old-fashioned handwritten, pencil written letter to my office at 215 Newbury Street, Suite 102, Peabody, Massachusetts 09660. Whichever way you choose to participate, we'll read your question, we'll disguise your name a little bit, and we'll talk about natural health ways for you to get better, because natural health ways help probably 80 to 90% of day-to-day healthcare problems get better. Thanks for watching. We'll see you next time. Bye-bye.